Hello, my name is Aditya Kapoor. I'm a senior consultant orthopedic surgeon and I've been trained both in India and the United Kingdom. I specialize in joint replacements, arthroscopy and sports medicine, and trauma. My particular interest happens to be with cartilage regeneration and joint preservation surgery of the knee. We perform and have been performing joint replacements of the hip and the knee regularly. I usually perform cemented and uncemented hip replacements for a variety of conditions such as arthritic hips, rheumatoid hips, avascular necrosis of the hip, and secondary arthritis following either trauma or healed infection. We also specialize in revisions of the hips and are in a position to perform and have been performing complex surgeries. We also perform knee replacements regularly. Our knee replacements, we use Asian specific knees which provide a higher degree of satisfaction to the patients. This promotes higher flexion and a more normal feel with an early recovery. We use computer navigation in our joint replacements. We have performed knee replacements in complex deformities successfully. We also perform partial knee replacements. For people with early arthritis and in whom focal cartilage defects exist, we have performed surgery where we have taken their bone marrow, isolated mesenchymal cells which have been concentrated, and using arthroscopic procedures have pasted it back successfully on the cartilage defects with excellent results. We perform revision knee surgeries. We also perform osteotomies for early arthritis, which results in deformity correction and helps people recover early with joint preservation. For people who have ACL surgeries, we employ a technique called as all-inside ACL reconstruction through small keyholes as well as avoiding big tunnels. We have also been performing revision ACLs, PCLs. We do multiligamentous knee instability. We also promote preservation of menisci. We have been performing keyhole surgery of the shoulder both for Bankarts as well as for rotator cuff repair. We have successfully performed complex trauma surgery of the hips, knees, the lower limbs, upper limbs. We employ modern AO techniques and use the OTA principles. I would like to highlight some of the cases we have done. A 42-year-old gentleman came with severe pain of his left hip. He had undergone 2 previous surgeries when he was younger for a fracture of his hip. That malunited eventually, and when he was about 42 years old, he could barely put his leg down. So when I first saw him, he couldn't even stand upright. X-rays revealed post-traumatic arthritis. So we went ahead and we performed an uncemented hip replacement, and following surgery he recovered very well, started walking the same evening, and about 6 weeks after surgery he didn't need any help to walk at all. His leg length was equal, he didn't have any pain at all, and it was a complex deformity which recovered successfully. To illustrate a knee with a complex deformity, a 71-year-old gentleman was brought from overseas. He had a severe varus of his leg, which we saw with a long leg x-ray. He had a huge chunk of bone missing from the medial tibial plateau. So we performed knee replacement, augmented the tibial plateau with some grafts and with screws, as well as used a stem. He achieved full correction of his leg and was walking the next day and has made a very uneventful recovery. Another lady was brought to us with significant arthritis of both the knees. She had a malunited fracture. Because it was a complex deformity, we went ahead and we used navigation. We achieved full correction and she was walking successfully without any aids. Some of our knee replacements, we tend to make them walk within 3 hours of surgery, performing advanced techniques of infiltration and pain relief. We've also been performing complex trauma and reconstruction. To highlight one of the cases, a gentleman who was brought in with a tibial plateau fracture and compartment syndrome on a public holiday. We went ahead, we did a decompression of the leg, and we used what is called as an external fixator, as well as fixed the tibial plateau with screws. 8 weeks later, the fracture had healed, his skin grafting was done, and his fasciotomy wound healed. A couple of months later, he has achieved full knee flexion, is walking without support, and has gone back to his normal life. Another gentleman who came in with his hand split open following a road traffic accident, again on a public holiday. We went in, we stabilized the hand, sutured it up, and miraculously he is healed with no further problems at all. A lady who is 59 years old was brought. She had increasing pain of her knee, and subsequently an MRI revealed that she had a focal cartilage defect as well as a meniscal tear. So we carried out an arthroscopy, a debridement of the knee, did a procedure called microfracture where we made small holes in the knee using keyhole surgery. We took her bone marrow, we isolated the mesenchymal cells from it, and along with the paste, pasted it back in the focal cartilage defect. 12 weeks later, she has made a full recovery, she has no pain, is walking without support, and has returned to her normal life. We call this as joint preservation surgery, and we feel that done early enough, it saves a number of knees.